Welcome to Facebook Live. I'm Dr. Annette Mercatante from the St. Clair County Health Department.
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management.
We're here to answer your questions, so please write them in. We'll try and get to as many questions as we can. As usual, we'll take a few minutes right now to go over the most current data, which can be found on our website. That's updated daily at scchealth.co. So today we have, in the last 7 days, a total of 24 new cases. We are at an average of about 3.5 cases per day over the course of a week, which is down. And about 265 tests are being done per day, which is up very much and stable is where we want it to be. With that, we can report a very favorable percent positive testing rate of under 2%, 1.9%. So overall, our testing is stable and our percent positivity is down, which would suggest that we have a lower rate of transmission in our community. We can also report that we've had 0 deaths in this community in the past week that have been reported to us, and only 3 hospitalizations. So all is good on that front. We continue to see stable, if not decreasing rates. Next is the data related to just the cumulative cases. And again, you can see our graph, the up and down. We're starting to kind of look, will we see a seesaw type of picture, or will we see deep peaks and valleys? And it's a little too early to tell. But again, you can see we started to go back up, we came back down, and it appears that we're on a downward slope at this time. Our next slide is the percent or the number of tests juxtaposed with the percent positive testing. The red line is the percent positive testing, so you can see we are not seeing an increase in positive tests with the stability of the number of tests that we're doing. Good news. And finally, just a snapshot of our dashboard on our website, where you can get updated cumulative totals and other general information broken down on demographics, male and female, etc. So the data is on our side this week, as it was last week, which gives us lots of opportunity to talk and plan and consider what we should do next.
And I think one of the big things is this is the 3rd week in a row where we haven't seen a fatality. So that's
right. That actually brings me to the first question. So let me get to that right now while people are sending their questions in, because one of the questions that came in is we haven't had a COVID-19 death in several days, actually more than that. Yep. Is it because those that are becoming infected are younger and healthier? And I would say more than likely, yes, that has a big component of the issue. There doesn't appear nationwide to be any significant mutations of a virus that would make it affect our bodies differently. Medical care has to some degree, but people aren't even landing in the hospital at this time, let alone dying from it. So I do believe that the majority of the reason, the primary reason for lack of hospitalizations and deaths is just because this virus is circulating in a younger, healthier population, which is good news, kinda, except when you have a virus that's circulating in one population, if you're not careful, it can easily spill over into another, because young people don't necessarily stay away all the time from the more vulnerable people. So.
Justin, you want to take your
Yep,
first
I'll take my
question,
first one.
and we'll
So
go to the live.
the first question is, all of the in sports, are they going to be traveling to other schools in other counties as normal? And currently, we're following all the MHSAA guidelines for school sports. And we do know that we're awaiting some further guidance by tomorrow, by Friday, in the late afternoon. By that time, we expect the final decisions from MHSAA on where fall sports are going to go for the 2020-2021 school year.
Okay, we'll go to the first question on the live feed. Is having considered high risk?
The question is Hashimoto's disease, and is that considered one of the risk factors for a more severe form of COVID? Hashimoto's disease is an inflammation of the thyroid gland that can lead to thyroid disorders, either high or low thyroid conditions. And the answer is no, it's not on the list. Thyroid disorders don't seem to necessarily increase your risk of more severe COVID, but given that Hashimoto's can be an autoimmune type of condition, I'd be careful. I would say any chronic underlying disease that is making you feel ill and is giving you trouble should be considered a potential risk factor for COVID.
Okay. Next question. How long does it take to get results from testing, and is there any rapid testing available?
So the testing is currently taking, again, I believe it's 2 to 3 days. Am I right, guys? It changes all the time. I would say we're getting most of our tests back easily within 3 days. So that's good news. It can change at any given time. We would love to tap into rapid testing, but rapid testing continues to be a resource-limited type of thing. Our hospitals have access. They use it accordingly for their own resources. And when those resources expand, meaning basically the supplies expand, we would love to tap into it. Do know, though, that rapid testing is not as accurate. In fact, we would not rely on rapid testing to diagnose and confirm a case. We want to use PCR testing, which is the most accurate form of testing. So it may make you feel better quicker, but I'm going to go back to that same old story I keep saying. If you have been told that you have an exposure and you're supposed to quarantine, a negative test does not get you off the hook. You still need to stay quarantined for 14 days. I don't care if you had 5 negative tests. Until that 14th day is over, you could still develop replication of the virus and transmit it. Okay?
Okay, next question. Another round of major allergy season is coming soon. How do we go into our workplaces and schools when some symptoms are similar and
Very
will
similar.
you get sent home?
So the question is allergy symptoms and COVID symptoms. You're right, especially again in this young, healthy cohort of individuals. Many of them are reporting that they just thought they had allergy symptoms. I can tell you that many of them, their allergy symptoms change a little bit. They get a little more severe. It's a little bit different than before. And I just have to say, in this day and age, err on the side of caution. If you're having allergy symptoms, they're lasting a little bit longer than they normally do, it doesn't hurt you to get a COVID test, right? There's no, just come on in or talk to your doctor, and because you could be, quite unfortunately, inadvertently transferring the virus to other people and not knowing it. You do not want to be the one for us to call and say, hey, your COVID test is positive and you've been to all of these places in the past week, spreading it around. It just feels terrible when people do that.
So along those same lines, same question and then a different question. Should people go to work if they have those types of symptoms, not knowing if it's allergy or COVID? And will they be sent home if they go?
So the absolute correct answer, I think, is that if you have symptoms and you're not sure if they're COVID or not, and you do have symptoms, go get tested. That's the best way of us being sure. And if your test is negative and your doc says, or your symptoms are consistent with the allergies and your test is negative, good to go. But if you are having symptoms, don't go to work until you've had that test. Okay, and then you have a nice new baseline to start out from. Now, if you have allergy symptoms, you get a test and it's negative, and as allergy symptoms tend to just go on and on and on, right? They don't go away for a while. 2 weeks later, they're still there, but they're different. Go ahead and get a second test. We've actually had that happen where people have had an initial test negative because of allergy symptoms. A subsequent test later on has turned positive, but when you really ask them carefully, the symptoms did change a little bit. So be aware of that.
And remember too, you need to keep yourself isolated after you take the test until you get the test results.
Especially if you're symptomatic, people.
Correct. Okay?
If you're symptomatic and tested, you should not go out until you know the results. And if you are not symptomatic but have been told to quarantine, I just mentioned, you're not supposed to go out even if your tests are negative. And if you've just been bopping around, you decide you want a test just because you want one, you heard that somebody knows somebody that knows somebody, that doesn't count. You can get a test and go on your merry way. But if you've been told to quarantine or you're having symptoms, you do need to stay home, okay?
Okay, next question on the live. Is there a throat swab and nasal swab? If so, which one is more accurate?
So there's 3 ways to get a specimen for PCR. There's the nasal pharyngeal, the one that goes way back, the anterior nasal, and an oral pharyngeal throat swab. When all this started up, there was no question the nasal pharyngeal was considered the gold standard. Now they're just saying from any 3 locations is adequate. They feel that the test is sensitive enough and the false negative rate is low enough that we could tolerate getting the samples from anywhere, which is good news for our kids and some of those people that don't want the swab all the way back.
Okay. Next question. If you had COVID years ago, can you develop it again? I was wondering if maybe some people that are exposed years ago maybe aren't getting sick.
So the question is, if you've had COVID years ago, can you get it again? And this is a novel virus. Most people believe it didn't even exist until the latter part of 2019, which is why we call it COVID-19. It is a mutated version of a coronavirus, and as you know, we've had SARS coronaviruses and MERS, but those viruses do not cross-protect against this, including if you've had a coronavirus, a normal one that just causes common cold symptoms. It is not protective to this one. So the answer to your question, quite honestly, would be no. This is novel, and as far as we know, the only way you could potentially have immune protection from this virus is to get this virus and or get a vaccine, neither one of which we're 100% certain of just yet.
Right.
So stay tuned for that information.
All right, Justin, why don't we go to you with the question on your paper there?
Sure. So the next question is, what kinds of things are schools trying to work through right now, and are there any updates from the school work group? So the schools are continuing to work through their return to school programs. A few of the schools have announced, one of the school districts is going online only, one is going hybrid, and most of the rest of them have an online version and a face-to-face version of some kind or another. And they are all working diligently to make sure that the students have a safe environment to return to while managing the risks of COVID-19. As far as updates from the work group, basically, all of the school districts at this point have pushed information to their families from that work group. So it really wouldn't be worthwhile for me to regurgitate that. But do pay attention to your school districts, because they are the absolute best source of information.
Okay. We don't have any questions right now.
I'll take the next one, because there's a really good question somebody sent in about if an employee at a business goes on vacation to a state with a surge in cases, required to quarantine for 2 weeks after they get home. The key word here is require. And no, Michigan does not have a requirement for quarantine. There are some recommendations if you've been internationally traveled. You might be flagged when you return, and you'll get a call from us, and we'll be asking you to self-monitor. And there's no system like that in place for travel within the United States. With that said, do the right thing. Okay, do the right thing. There's a great website called Harvard Global Health. It's a website where they track very specifically counties and the number of cases throughout the nation. And you can actually look at the county that you travel to and see what their transmission rate is. And if you've been to an orange or a red county, or if you've been anywhere and you know that you've been doing a lot of stuff that maybe is putting you exposed to a lot of people, please be careful when you return. Please. So we call it self-quarantine, self-monitor. Hold off on going to big parties. Hold off on seeing vulnerable individuals, elderly people, people like that. Just give yourself those 14 days to be sure. Because again, you feel really crummy if you go and do all that stuff and end up sick, and then we go, oh, by the way, you're contagious 48 hours before the day you get sick. And in those 48 hours, you were someplace that exposed some vulnerable people. So just do the right thing. If you can, back off. If you are an essential employee, you're not required to quarantine, but be careful when you're at work. Absolutely wear your mask. Absolutely keep yourself social distance, and be careful with your colleagues and your coworkers. Try to avoid getting very close to them.
And I think there's a point to that essential worker thing too. Remember, if you're an essential worker, yes, you can go to work. Yes, you can do those essential things, but that doesn't mean after work you can go out and hang out at the supermarket and hang out, at your kids' whatever they're doing, and all those other extracurriculars. That basically means you are authorized to go to and from work and back to your home. And be careful from there. That's what that allows.
We've had some really great examples of people who felt they could have been exposed. It was a little too soon. We didn't have the results back, and it turned out they were. But in the interim time frame, they were careful. They were super careful. And you know how
Yes.
many contacts we had to deal with?
0.
0.
Yep.
Yay for them. So this is the kind of thing you can do if you think you've been in a high risk situation. Just pull yourself back. Try not to get exposed to any other people during that 14-day period. You do not have to run out and get tested. As I just mentioned, a negative test doesn't really mean anything. If you get tested on day 4 of your incubation period, you could still become positive on day 10 or day 14. So just take those 14 days as a time. 2 weeks is going by really quickly, right? 2 weeks isn't a terrible amount of time. And just pull away. Try and avoid going to the bars and the restaurants. And oh wait, you're not supposed to be at bars anyways. So just, pull yourself back. The bars aren't open, remember that.
We don't have.
Of the disease, then that's really good. As far as travel, there still is a border closure between Mexico, the United States, and Canada. So unfortunately, you won't be able to go over the Blue Water Bridge. Sorry, that we expect that to continue after September 1st, but that's when the deadline is currently. So we'll see on that. So traveling over Labor Day, obviously people are going up north still to the upper parts of Michigan and out into other states. It's the same thing. Just understand there's some limited resources still up north, but they have managed to kind of make it through all summer. So just be aware of that if you should go up north.
And within the state, the My Safe Start dashboard is also a really great place to get very updated which communities are going up and down. So our hotspot right now is the Detroit area.
Yeah.
You still want to be careful if you're heading down that way. Heading up north, they're all doing a little bit better, but that doesn't mean you should let your guard down and go to big parties. Just keep your distance from people. You can still have a lot of fun and not be like packed in. Any more questions coming in?
Nope.
Okay, so I'll take the next one. The question about community clinics, and they want to know 2 things. Where is the test sites? So we have a community clinic tonight from 3 till 7 at Memphis. Do you know, is it at the Memphis school?
It's at the middle school, high school.
Middle school, high school.
Yep.
On Tuesday, next Tuesday, the 25th, we'll be at St. Edwards on the Lake. And on Wednesday, August 26th, we'll be at the Port Huron Area School District Admin Building. Okay, so those are all clinics that are from 3 to 7. We prefer an appointment. You can go on our website and make an appointment, but walk-ins or drive-ins will be available. And immunizations and waivers are also available there, so you can kind of kill 2 birds with 1 stone. We have them separated, so if you just need one, you don't need to get into the COVID thing, don't be afraid to come. Everybody's being really safe, and we can safely administer those vaccines to you without cross-contamination. So that's the good news. The other question is, what are we going to do after August? And if we're going to offering any more community clinics after August. And all I can say is we're here to respond to this issue, and we're trying to be as flexible as we can. So after August, our plan will be to bring in the testing back into the main health department here and offer it by appointment 5 days a week. So we're going to incorporate right into our normal activities. You need a COVID test, you just call, we'll give you a COVID test. Okay, that's pretty simple. But I have to say, if there are special needs, if there's special issues or outbreaks, our team is ready to go out and mobilize again. We're going to just keep doing what we need to do to provide the support and resources that we all are needing at this time. So stay tuned.
Yeah, and I'll just jump on real quick. The department has come up with a very good way to become exportable and move around the community and really do a good job at this. So I just want to tell you that.
Yeah, we can do it well. Here's the problem,
you guys
though,
have
is
become
that
very good.
if we go out there, we have a hard time being here.
That's right.
We don't have enough staff to extend in both directions simultaneously. So we have to consider other mandated services that we have to do here, and we want to keep providing those services. So that's really our issue. The reason we're not doing both all the time is just we don't have the people. Yep. So we'll figure that out.
But my point is, you guys have done a great job, and
we know how to do it.
It's been really good.
No question, we know how to do it.
Another question came in. Are there plans in place for the schools when there's a positive case? Is it state regulated or by district?
So the question about what do we do with cases in the schools, it's really not a state regulated, although there is a statewide work group that I've been very active in participating in that's trying to develop standards that are consistent across communities. So the answer to that question, though, is it's a little complicated, but a positive case will be dealt with the same way it is anywhere else. So if you have a child or a staff member who is ill or has been tested positive with COVID, they are isolated. They were removed, and we do a contact investigation, and we try and identify who has had close enough contact with that individual to warrant concern and get them out of the school setting as well, to quarantine. And that will be done between us and the school. Okay, so we'll make that decision. Anybody who's been identified as a contact will be notified. We do not notify anyone on who that person is, who the case is. We'll say there has been a person identified as positive and you have been identified as potentially having exposure and contact, and then we'll give you the information you need to know what you do, which is basically going to be 14 days of quarantine. Okay, you're going to go to virtual learning, you're going to stay home and monitor yourself for symptoms. The rest of the school should also be notified. I know that this goes through the wildfire, so everyone will be notified, but the rest of the school will be notified in, hey, there's been a case in the school, but you're not involved. You just carry on, and this other part's been taken care of. So those are the two types of communication that we'll be seeing very consistently. Now that's for one case. What do you do if we have 2 or 3 cases? It gets a little more complicated after that, but we are developing guidelines for us internally as a health department to help guide the school systems in when there's too many cases to continue doing in-person learning. And that is some information that's going to be coming out very soon that I'll be sharing with the school districts. But again, it's going to vary based on the school situation and the amount of transmission that we have in the community as well. So yes, answer your question is yes, those plans are available, but we realize that we're going to have to be somewhat flexible with them as well.
Okay, we have about 5 minutes left, so I wondered if you wanted to tackle the mask question.
Oh, so the question is, will students be allowed to return in-person instruction if they have a doctor's note saying they cannot wear a mask? And I'll tell you the public health perspective, and then I'll tell you the reality of what's going to happen in the schools. Ultimately, this decision is up to the schools. They have to make that decision with their own legal counsel and their own internal work group. If you have a legitimate medical note that says I am medically unable to wear a mask, that is right in the school return toolkit, that you wear a mask unless you can't. All right, so the medical note will be required as an exemption. The question is whether you'll be allowed in the school in person without a mask, or whether you'll be your accommodation for that inability to wear the mask would be virtual learning. That is ultimately going to be up to the schools. Our impression as a public health entity is that if your child or as an individual you feel that you are unable to wear a mask, you shouldn't be in school. You shouldn't be in the same building with all the people who are. If that happens, I hope that there will be accommodations made where that individual won't be necessarily lumped in with everybody else and moving from place to place like everybody else, because it is an increased risk to the other people. So that's our advice, and we are asking as well our physicians to be very careful about writing medical exemptions, because the reality is there are very, very few medical exemptions for mask wearing. In fact, if you have asthma or respiratory diseases, you are more susceptible to severe COVID, and you should be even more inclined to wear a mask. You're the people that should be wearing a mask if you have asthma, because if you get sick, you're going to be much more likely to have severe illness. There really aren't a lot, but we know medical exemptions are going to be written. We know there's all kinds of philosophical and ideological differences about this, but the reality is masks do save lives. They prevent you from giving your germs to other people, and there's probably growing evidence that supports that if you're wearing your own mask, you're not as likely to breathe in quite the same viral load as if you weren't wearing a mask if someone inadvertently coughed in you. So we believe in masks, and we think with the issue of bunches of people going back into a building, like we're asking our students to do and our teachers, we should be taking every precaution we can to protect them and reduce their risk, and that means wearing masks. So long and short of it is we prefer not. If you have a true medical exemption to wear a mask, we prefer you to find alternative ways of getting your education other than in-person learning, but that decision will be made by the school district.
Okay. Closing remarks.
That's it. No. I just want to say again, we're in a good place right now, St. Clair County, and it's all because of you. It's all because of the work you've done. And I just can't thank everyone enough, and I know everyone's tired, but we just got to hang in there and keep doing this. Find ways of making yourself happy. Masks are a pain. Where's my mask? Oh, I lost it. Masks are a pain, but you know what? Find different styles. Find different ways of giving yourself breaks. If you take the mask off, remove yourself from other people, and I think we're all going to find that we can do this without a whole lot of stress. So.
Yep. And so I want to say is, like Dr. Mercatante said, the community is doing a really wonderful job. And I know there's a lot of changes, right? We've lost football. We've lost a lot of the things that we do in the fall. The kids are going back to school in many different ways, and things like homecoming and other dances and other get-togethers, and you know, you walk outside and it smells like fall, except it just doesn't feel like fall right now. And I know that that's terribly impacting. And so what I'll say is, this is just going to be a short period that you're going to remember for the rest of your lives. And so just hang in there. It feels like it's never going to end, but it will end. This socially will end, okay?
Yeah.
So just hang in there, keep fighting, and we'll be back with you very soon.
And don't forget to take those breaks.
That's right.
We still have some nice weather, so go out for a walk, take your bike out.
Take care of yourselves.
Take care of yourselves.
We'll
and
see
we'll
you
see you next week.
Nice.